Do you admit every solid organ injury after a blunt abdominal trauma? Hi, I'm Cecilia Gigena from Cincinnati Children's Hospital, and I think this is an article that you should know about. This is a retrospective study done in South Carolina, and they wanted to see if every isolated solid organ injury after an abdominal blunt trauma can be discharged from the ED. And what did they find? They gathered 262 patients with isolated solid organ injuries grades 1 to 3. 148 patients had solid organ injuries grades 1 or 2, and none of them required an acute intervention. From the 114 patients with grades 3 injuries, only 3 patients that require an acute intervention. So it seems that isolated solid organ injuries after a blunt abdominal trauma, grades 1 or 2, can be discharged from the ED. Stay tuned for more articles that you should know about.